adopt the report of the Portfolio Committee of Health on the budget and APPs of the department and the entities this morning. I will ask Ms. Majalamba to give me an indication of attendance and apologies, please.
Good morning and thank you, Chair. Present is Dr. Jacobs, Ms. Geller, Dr. North Nahal, Ms. Wilson, Dr. Tembekwayo, Ms. Cherwa, and Mr. Van Staden. I've received apologies from Ms. Sukers and Mr. Imam Sheikh. Thank you, Chair.
Thank you very much. I'm just counting 1, 2, 3, 4, 5, 6, 7. Yes, we will continue, honorable members. We do have a quorum for this meeting. I will now read the preamble or the guide for the chairperson of the Portfolio Committee on Health, and thereafter I will.
No problem with volume, your laptop. Yo, sorry.
What's your number?
Sorry.
Please mute your device, Ms. Majalamba. All right, so honorable members, before we proceed, I would like to remind you that this virtual meeting is deemed to be in the precinct of Parliament and therefore constitutes a meeting of a committee of the National Assembly for official purposes. In addition to the rules of virtual sitting, the rules of the National Assembly, including the rules of debate, apply. Members enjoy the same powers and privileges that apply in a sitting of the National Assembly. Members should equally note that anything said in the virtual platform is deemed to have been said in the House and may be ruled upon. All members who have logged in shall be considered to be present and are requested to mute the microphones and only unmute when recognized to speak. This is because the microphones are very sensitive and will pick up noise which might disturb the attention of other members. When recognized to speak, please unmute your microphone and connect your video. Members may make use of the icons on the bar at the bottom of their screens, which has an option that allows a member to put up his or her hand in order to raise points of order. The Secretariat will assist in noting the chairperson. When using the virtual system, members are urged to refrain or desist from unnecessary points of order. We shall now proceed with the business of the day. I have asked the host to make me a co-host so that I would be able to flight the documents myself, and we will go straight over to the screen, which would be this one. See my screen now?
Yeah, if I may.
I see your hand is raised.
Yes, please, Chairperson. I know what I have seen the agenda for today. Before we continue, please may I just ask that at the end of this meeting, there's something I need to raise, if we can just add it to the agenda as matters arising. Thank you, Chair.
Thank you. I'm noting that. Thank you. So, honorable members, this is a very long report. We know that it was packed week in which we had to receive the APPs and the budget entities. It's quite a lengthy report, so I'm going to approach this report in the following manner. I would want us to look at the at the table of contents, just very shortly, so that we familiarize ourselves. And you would have received this report yesterday morning very early, and a lot of you would have read this because it's impossible for us to go through the entire report. So just to be as a reminder, I just need to remove something here. Just as a reminder, I'm going to be looking at screens 1 to 2, screens 3 and 4, a little bit on screen 5, and then go straight to the point number 2, which is consideration of the annual or section 2 of the annual performance and budget of the Department of Health for 2023-2024. Raise a few points from there. Only points 2.24, 2.4, 2.5. Then go straight to committee to consideration of the APPs and budgets of the entities, and raise from there only the committee observations on the entities, which are slides 103 to 104. And then we go to the committee recommendations. If you do have anything you'd want to raise on the report as I go through this report, please just keep that until the end of the presentation that I'm going to do, and we'll be able to get through this very speedily. So report of the Portfolio Committee on Health and Budget, Vote 18, Health Annual Performance Plan of the Department of Health and its entities, dated 3rd May 2023. We having considered budget Vote 18, Health, together with the 2023-2024 annual performance plans of the Department of Health and its entities, and they are mentioned there. The ones which we had received this were on CCOD, the Office of Health Standard Compliance, National Laboratory Services Council for Medical Schemes, South African Health Products Regulatory Authority, and the South African Medical Research Council. We report as follows. Then in terms of the purpose of the report, it summarizes the presentations received from the Department of Health and its entities, focusing on the 2023-2024 annual performance plans, as well as allocations of the medium-term expenditure framework period. We further received reports from the Auditor General of South Africa on its review of the 2023-24 health sector APPs and an update on material irregularities in the health sector. It details the deliberations, observations, and recommendations made by the committee relating to Vote 18. Then I will move straight to screens section 2. Which is consideration of the annual performance and budget of the Department of Health. And the health budget, we note that the health budget declined by 6.9% in the 2023-24 financial year, and is expected to grow by only 0.4% over the MTF, compared to average growth rate of 8.3% between 2019-2020 and 2022-2023. We also note that over the 2023 MTF, department's focus will be on the following: preventing and treating communicable and non-communicable diseases, overseeing primary healthcare services, and the shift of Port Health from the primary healthcare program to the newly established Department of Home Affairs entity called the Body Management Authority, strengthening the health system and preparing for national health insurance, supporting tertiary health care services, investing in health infrastructure, supporting tertiary health care services in provinces, and developing the health workforce. Policy priorities for 2022-2023 in alignment with development agendas. We note that the programs which were used, or the documents were used at the State of the Nation address, and particular matters which the president had put emphasis on: the impact of climate change on the health of our people. Number two, state of disasters declared in response to the electricity crisis. President made mention of Africa's world-class manufacturing capabilities, the hemp and cannabis sector, etc. Just a few of those. I will now go to 2.2.4, which are the planned policy initiatives of the department. And we note a few things. One is, which are the key policy priorities of the department: the National Strategic Plan for HIV, TB, and STIs 2023 to 2028. And the first generation of this National Strategic Plan was launched in 2023. It will ramp up its efforts to reach the 95-95-95 goal. Includes provinces scaling up pediatric HIV treatment that is more effective and easier for caregivers to administer. TB remains the leading cause of death in the country, and more focused measures will be implemented to tackle both TB and HIV in order to transition to the 95-95-95 targets set for both TB and HIV. To reduce non-communicable diseases, the National Strategic Plan for the Prevention and Control of NCDs 2022 to 2027 will be implemented to reduce the rapid growth in the NCDs, including, amongst others, cancer, diabetes, and mental health. Changing behavior, raising awareness of status regarding hypertension, diabetes, and cholesterol, as well as preventing complications resulting in disabilities. Key priorities. Department is also prioritizing multi-sectoral approach to the community's productive needs. In particular, the department aims to address the issues of an increasing number of younger women delivering babies in facilities, and facilitate the implementation of the National Health Insurance Service. It will continue to prepare for the implementation of the proposed NHI. It's in the process of developing and implementing the electronic health record, which collates all the patient's health data and information into one digital record, providing complete and up-to-date information at the point of care. Community participation will be fostered through Invisos. Youth zones will be expanded to primary healthcare facilities to address HIV amongst youth. Improvement of health system infrastructure. The department will continue to implement the 10-year National Health Infrastructure Plan, which includes maintenance and refurbishment of health facilities. I will go directly to point 2.4. I'm not going to deal with all of these, honorable members. So in terms of the 2.4, the consolidated health budget, just to note a few things, is the consolidated budget totals 259.2 billion rand, which is down by 7 billion rand from the previous financial year. A significant segment of the consolidated health expenditure, 63.1%, is dedicated to compensation of employees, and which totals 163.6 billion rand, up from 159.6 billion rand. Consolidated health expenditure on goods and services total 76.1 billion rand, which is also down. And consolidated health expenditure makes provision for 13.3 billion rand allocated to capital spending and transfers, and there is no allocation for interest payments. However, given that provinces are known to run high levels of accruals, this is likely not accurate. Suppliers are probably charging interest for late payment. District Health Services receives 43.6%, the largest proportion of the consolidated health budget, and Central Hospitals, which receives 48.6 billion rand, totaling 8.7%. I will go to point 2.5, our committee recommendations. Committee recommendations on the department. The department noted with concern the report of the committee noted with concern the report of the FFC highlighting the severe shortages of healthcare workers and inquired about the current vacancy rate for nurses, doctors, and specialists. Wanted to know how the department is going to address this. Committee noted with concern the delays in the placement of interns and community service doctors. Want to know how the department is addressing this matter. Committee saw progress on the training and upskilling of nursing staff and the reopening of nursing colleges. Now, the committee noted with concern the decreased budget of the department, which would have a negative impact on the delivery of health services. The increase on the burden of communicable and non-communicable diseases raises a concern to the committee. Committee noted with concern the increase in cancer rates, shortage of oncology facilities in the country, which is said to be contributing to cancer deaths. On non-communicable diseases, the committee inquired on whether the department could provide a report on the success of its NCD programs funded through the sugar tax. The committee sought an update regarding the implementation of the Commission for Gender Equality's recommendation, the report of forced sterilization of women living with HIV/AIDS in South Africa. Wanted to know the status of surgery backlogs, what are the plans put in place to overcome the challenge, inquired about the impact of the recent labor unrest on the public health sector, expressed concern about the backlogs in the forensic chemistry laboratories, asked for the timeline for the analysis of the outstanding samples, inquired about the steps the department has undertaken to mitigate the impact of the fire at Charlotte Maxeke Hospital and the restoration of oncology services. Wanted to know whether the department's monitoring the implementation of the recommendations of the transfer of level 2 patients from Mpumalanga province to Mamelodi Hospital is a concern to the community. Want to know how this will be resolved. Wanted to know whether the department is going to address a shortage of equipment and infrastructure challenges, including the maintenance of existing infrastructure. Committee wanted to know how many health facilities are exempted from load shedding and how much has been budgeted to mitigate the impact of power outages in health facilities that are not exempted. Inquired about the cost for the planned upgrades of 45 primary healthcare facilities, 30 hospitals, and whether the department would have adequate project management in place. The committee is pleased that the department is increasing efforts to strengthen the management of medical legal claims and sought further details on the draft bill on medical legal claims. Noted with concern that the costing model for the NHI is still outstanding, yet 1.5 billion rand has been allocated for the department. The Department for NHI, considering National Treasury, has not engaged the committee about the costing model of the NHI. Committee inquired about the key stakeholders in the district health system framework and how it will enable the platform for the implementation of the NHI. Expressed major concern about the lack of access to emergency medical services in rural areas such as the Northern Cape province. It's concerned that the patients over 60 years are being refused kidney treatment, particularly in health facilities. Wanted to know what the rationale was for this. Noted there are new performance indicators under program 1, 2, 3, and 6. Wanted to know what the reasons are behind the removal and replacement of indicators. Wanted to know the kind of challenges the department is experiencing in the rollout of the CCMDD program. Wanted to know the strategies put in place by the department to ensure that 50% of women in senior positions. Noted concern that almost all entities were understaffed. Flagged the need for an engagement between the Council of Medical Schemes and the department to discuss the need to limit levy increases incurred by members of medical schemes, considering that there is a 98 billion rand surplus with medical aids. Committee requested an update on the status of the report submitted to the minister by the CMS on the rollout of the low-cost benefit options. Inquired about the allegations of tender rigging for the department's new head office and asked what legal process has been undertaken to address the matter and whether investigations are currently underway. The committee wanted to know what the department is doing to protect whistleblowers and closing the gaps of corruption practices in the health sector. Committee expressed that the dumping of medical waste needs to be looked into, in particular, the irregularities in the contracts and the storage of medical waste. Section 3 is consideration of the APPs and budgets of the entities. I'm not going to deal with this section apart from our observations, which are in 3.7.1. What has happened to my? Let's go to. On 3.7. Committee observations. I will go through all of them. CCOD, committee observed CCOD has done well with its annual financial statements and auditing. Commended that it has received an unqualified order for 2021-2022 financial year. Commended CCOD for the electronic system of claims and payments that has been put in place. Inquired about the CCOD's plans in filling current vacancies. Inquired on the strategies and efforts being put in place to address revenue collection and completeness of registers of mines and works. They further wanted to know which mines were still not paying levies. Wanted to know what measures the CCOD put in place to ensure that the office is more accessible. Concerned that only 71% of the budget is spent on goods and services and 34% spent on capital expenditure. Noted with concern that there were still outstanding claims and wanted to know when it was addressed. The committee further wanted to know how the value of the claim was determined. Want to know if there are any claimants who have been scammed and sought an update regarding the submission of amendments to the Occupational Disease and Mines and Works Act, which is called OGIMWA. On the OHSC, commended the OHSC on its audit outcome, welcomed the new board members, concerned about the targets the entity has set itself and wanted to know why they have decreased, wanted to know whether OHSC has assessed the impact of the labor unrest on healthcare facilities, wanted to know the percentage of health facilities inspected in the previous financial year and the number of private facilities that were non-compliant. Question how the National Health Insurance will be implemented in the public health facilities, OHSC, are under-resourced. Inquired about the decrease in inspection of public health facilities and the increase in private health facilities. So details on the training of inspectors. I want to know if the training will lead to career advancement for the inspectors. On the NHLS, welcome the NHLS's plans to request to be exempted from load shedding. Concerned about the media reports that there's a shortage of snake anti-venom. Wanted to know how the entity was dealing with the aging ICT infrastructure and ICT skills shortage. Concerned with the outstanding payments of 5.89 billion rand by provincial health departments. Want to know what the entity was doing to address this. So clarity on the impact of the delay in the publication of the NAPISA regulations on the NHLS. Expressed concern about the lower turnaround time for HIV viral load tests. Committee questioned the approval of sprinter buses without a proper plan to resource them. Inquired about the number of facilities which were affected by the appointment of service provider Zamalangeni Holdings expressed major concern about reported racism, sexism within the entity, asked whether it has implemented consequence management, wanted to know which forensic laboratories were taken over by the NHLS, and sought clarity on the difference between forensic and chemistry laboratories. On the CMS, committee wanted to know the reasons behind the high staff turnover, progress on the organizational restructuring process, about the plans for the entity to reduce legal fees, about the progress made in relation to the introduction of standardized low-cost medical aid packages, update on the review of prescribed minimum benefits and its finalization thereof, concern with the cost of living that was increasing, want to know if this has an impact on medical aid membership. We sought for an update regarding the finalization of the Section 59 investigation report and expressed concern over the proposed levy increases, which is needed to increase revenue generation currently being collected from medical scheme members, which is concerning in light of the high cost of living, and question the reasons why it is not carried by the medical schemes. On SAHPRA, the committee commended SAHPRA on the significant increase in fee income generation. Noted with concern, SAHPRA has 96 vacancies of highly skilled people who should have roles in pharmaceuticals and medical products, medical devices product assessment. Further noting with concern the high turnover rate, we wanted clarity on legislative objectives. Noted with concern the sharp decline in license applications being finalized, and asked whether the new business model has been communicated to applicants and how it affects appeals. We sought an update on progress made on review of the framework for cannabis regulation, and we conveyed our support for the ratification of the AMA treaty. On SAMRC, wanted to know if there's any regional work the entity is involved in which might be affected by the war in Sudan. We drew attention to the SAMRC's report, which states that unsafe sex and high alcohol consumption are risk factors for disease and death in South Africa, and wanted to know whether any research has been conducted to gain a deeper understanding of the causes of this social behavior and the intervention strategies to respond to these issues. Sought an update on non-funded Black researchers as reported in 2021 and questioned whether this has been addressed, and inquired on the reasons for the entity to use private laboratories when conducting studies instead of NHLS, whether the entity has conducted any research on adverse effects on COVID-19. We noted concern that among the non-communicable diseases, cancers are increasing, and what interventions is the MRC implementing in this regard. We question the reasons for the decrease in targets under program 2 and 4, so clarity on the decrease in the budget allocation to care programs such as HIV and TB and how the deficit will be mitigated. Welcome the 60% women representation in the organizational structure. Appreciate the leading role of women in the organization. Honorable members, we're coming towards the end. These are our committee recommendations. And we recommend that the Minister of Health should consider the following. For the department, in terms of human resources for health, should provide the committee with a set plan to address staff shortages in all categories, should provide a report on the placement of interns and community service doctors, should provide the committee with a detailed report on the training and upskilling of nurses and the reopening of nursing colleges, provide the committee with a progress report on the implementation of the community health workers policy, increase specialist training through more registrar posts. On improvement of the quality of health care, the department should address a shortage of equipment and inadequate infrastructure and report to the committee quarterly. Furnish the committee with an action plan aimed at addressing infrastructure backlogs and existing gaps. The department should collaborate with provincial departments in prioritizing the procurement of essential health technology for cancer management and a successful retention strategy for specialists, and furnish the committee with a report on the success of the NCD program funded through the sugar tax. Improve access to healthcare services. The department should improve access to emergency medical services, particularly in rural areas. Provide the committee with a quarterly progress report. Furnish the committee with an update report on surgery backlogs, as well as the backlogs of the forensic chemistry laboratories. Furnish the committee with a progress report on the implementation of the recommendations of the Health Ombudsman in relation to the Rahima Moosa Mother and Child Hospital. Furnish the committee with a progress report on Charlotte Mackay Hospital following fire and the restoration of oncology services. On medical legal claims, the department should provide the committee with a detailed report on its efforts to strengthen the management of medical legal claims and how it is assisting provincial departments in this regard. The entities, the department should engage the National Treasury in order to address the budget constraints within entities to ensure that they are properly funded to deliver on their mandates. On infrastructure challenges, the department should provide infrastructure technical support to provincial departments in order to develop the capacity to plan and manage health infrastructure delivery. Furnish the committee with a detailed report, including the cost thereof of all planned infrastructure projects. The department should ensure the implementation and investment of strategies aimed to mitigate the impact of load shedding on the delivery of health services and report to the committee quarterly. As far as the entities are concerned, all entities should ensure that they have proper systems in place to root out corruption, fraud, and maladministration. On the CCOD, ensure that all vacant posts are filled timeously, improve on the timelines in the payment of ex-mine workers, provide the committee with a progress report on strategies and efforts being put in place to address revenue collection and completeness of registers of mines and works. On the OHSC, submit to the committee the recent inspection report, in particular the inspection of private health facilities. Continue to strengthen its outreach programs and communication strategy. Ensure that vacant posts are filled, particularly posts for inspectors. And on the NHLS, present to the committee a detailed update on the process relating to the transfer of the forensic chemistry laboratories to the NHLS. Engage the department on the impact of load shedding on its operations in an effort to shield it from load shedding. CMS, provide the committee with an update on the review of PMBs in line with the health market inquiry recommendations. Committee to convene an engagement with the Council of Medical Schemes on the following 5 matters: to discuss the medical aid surplus of 98 billion rand to limit annual premiums to members of medical aid, to be appraised on the Section 59 investigation report, get a progress report on low-cost benefit options, to share with the committee the documents signed by key stakeholders on the collaboration to address fraud, waste, and abuse, inform the committee when the recommendations on the PMBs are finalized, including the set of recommendations made to the Minister on the primary healthcare elements of disease prevention and promotion. SAHPRA, provide the committee with a progress report on the filling of the vacancies, highly skilled positions. Furnish the committee with a progress report on the review of the framework for cannabis regulation, SAMRC. Furnish the committee with a detailed report on the prevalence of non-communicable disease in the country. Provide the committee with a report on cancer research conducted by the SAMRC. In conclusion, unless otherwise indicated, the Department of Health and its entities should respond to the committee recommendations in 3 months from the day the report is adopted by the House, and then the report should be considered and adopted by this committee. So, honorable members, let me just try to get my screen sorted out and be able to see when your hands are raised. Stop sharing. Now I'm back on. So that is our report, honorable members. I'm going to take any input. I've so far seen one hand, Honorable Clark. Only one member wants to raise anything. Honorable members, I hope you can hear me. I think there'll be only one member.
I can hear you, Chairperson. The Honourable Clerk will speak on behalf of us. Thank you.
Thank you. That's good news. They done very quickly. Honorable Clerk, thank you.
Thank you, Chairperson. Just in terms of the National Health Department, the one issue in terms of NHI, I would like to see that we add that the realignment of the timeframes of NHI need to be given to us because we're not in line with the timeframes at the moment. And these timeframes should be aligned with a costing model approved by National Treasury and the Minister of Finance. Thank you, Chairperson.
Thank you. Any other hands? Honorable Clerk, I hear what you're saying. I just need to make sure whether it was raised in the manner that you're raising it in the meetings, but I note, and I'm sure that the committee secretary and the team are noting too. Just to also thank them before I forget, they do a lot of work to compile these reports. It's really not easy. And I want to thank them for the thoroughness of that work. This is now the fourth time I'm going through this report, and I must say that I'm quite impressed with how it's been captured. Honorable Kaba.
Thank you. Chair, mine really is to welcome the report as presented, Chair, and raising my hand to move that we have the report adopted. Thank you.
Thank you. Honorable Gela.
Thanks, Chair. Chair, I rise in support of Honorable Kaba that we support the report as you presented before us as Portfolio Committee, and second, the adoption of the report as presented, Chair. Thank you.
Thank you. Honorable Thembekwayo, let me just look at this list now. Thembekwayo and Clark. You want a second chance, Honorable Clark?
Thank you, Chairperson. I was not aware that we're moving to adopt as yet. I thought we were now allowed to just give some input in terms of the report. But if we are at that point, then I would like to just put on record that we reserve our right around this report and that we will discuss this report at our caucus. Thank you.
Thank you, Honorable. Now, I had Thembekwayo first, but it's fine. Yes. So go to Susan Thembekwayo, followed by Honorable Van Staden.
Right onto the ramp. Thank you, Chairperson, and good morning. I just want to record that the Economic Freedom Fighters reserves their decision pertaining to the adoption of the report. Thank you.
Thank you. Honorable Van Staden.
Chair, no, thank you. Freedom Front Plus also reserve his right to take the matter to the caucus to reach a decision on this matter. Thank you.
Thank you. Any other members? Is that the legacy hand? Thank you. So, honorable members, we've heard honorable report to the caucus. The same has been by Honorable Thembekwayo on behalf of the EFF, and the same has been said by Honorable Van Staden on behalf of the Freedom Front Plus. There was a movement for the adoption of the report by Honorable Kaba, and it was seconded by Honorable Gela. So, are there any other members who want to say anything?
Thank you, Chair. I also second the third to be adopted report. That is well done. Thank you.
Thank you. Anyone else? So, honorable members, I would rule that this report is adopted. This report will now go to the National Assembly, where we will bring this report for adoption by the House on the 9th of May, which is next week, Tuesday. Just to remind you that it is a Tuesday and not a normal Wednesday, if I'm right. If I'm wrong, I need to be corrected by the committee secretary. Then a reminder also that on the 10th of May, we are resuming our work on the NHI bill. I would really want to ask us to complete this work before the end of May. We will have 3 meetings, and those meetings is one, I will give each political party and not each member an opportunity to raise shortly within less than 5 minutes their input on the opinions which they had received, and just
Chair, I'm terribly
legal
sorry to
opinion.
interrupt you, Chair.
Sorry.
I'm sorry to interrupt you, Chairperson, but we're losing you. I lost a whole section of what you were just saying.
Yes, Chair, the sound's very bad. Your bandwidth, it's not good.
Me too. I can't hear anything, Chair.
All right. Let's try to wrap up. I'm just trying to tell us what the program is from next week, so that we are all on the same, on par with what we're doing. So next week, Wednesday on the 10th, we continue with the work on the NHI bill, and on the 12th. And after that, we'd have to then probably proceed again on the 24th of May. Then we, honorable members, don't forget about the Presidential Health Summit. I don't really have it on hand now, but you have all been informed, but there is a challenge in that you have not indicated who will be representing you from your political party at the Presidential Health Summit. And then finally, Honorable Wilson wanted to say something before we close. the
Sorry,
meeting.
Chair.
Yes,
Can we
Can I-
adopt the minutes first? Can we adopt the minutes first, Chair?
yes.
We're going to adopt the report, then the minutes, then we'll go
And
to.
then say all these things. Yes,
source.
thanks.
Yes, Chair. Thank you.
Thanks, Majalamba. Can we start with the first set of minutes, please? Yeah, can you fly to? So, set of minutes of 18th of April 2023. It was a briefing by the FSC and by the AGSA. So the analysis of the health sector's annual performance plan and budget for 2023-2024 financial year. And also by the AGSA on, oh, my battery is running low. Also on, sorry, that was my battery that was running low. Our power has just been restored. And briefing by the Compensation Commissioner for Occupational Diseases on the APPs and budget for 2023-2024 financial year. Briefing by the Office of Health and Compliance on the APPs and budget for 2023-2024 financial year. Can you scroll? Make certain that you have been noted to have been in attendance if you were, honorable members. Next page. And then there is the briefing on the Financial and Fiscal Commission. And next page, still on the FFC, briefing by the Auditor General. Presentation by the CCOD Commissioner. Briefing by the OHSC. And the meeting was adjourned. Anything that you've noted, honorable members, which was either omitted or that you wanted to mention or that you had concerns with? No, it was captured. Nothing. Can I ask for adoption of these minutes?
Chair, I move for the adoption of the minutes.
Thank you. And the seconder?
I second the chair.
Thank you very much. These minutes are duly adopted by the committee. Next set of minutes, please, Mr. Majalamba. Which were on the next day, the 19th of April, briefing by the NHLS, the CMS, and SAPRA, also on the APPs and the budgets for 2023-2024 financial year. First page, note if you were present. Next page. The briefing by the NHLS. Anything there, honorable members? You want to raise? Next page. Briefing by the CMS. Next page. Resolutions, committee agreed meeting, and we've gone through this in our report to discuss increasing contributions, etc. to all those resolutions. Next page. Presentation by SAPRA. The meeting was adjourned at 18:30. Can I please get hands for adoption of these minutes?
Chair, I move for the adoption of the minutes.
Thank you. Any seconder?
Chair, I'm raising my hand to second. Thank you.
Thank you very much. These minutes are duly adopted, honorable members. Next set of minutes. Briefing by the Medical Research Council. You would notice that I was not present in this meeting, so I will please note there. You'll see my apology, but I will continue to go through this. And if there's anything which I'm not aware of, you're welcome to then raise it. So there's the briefing. Anything you want to add? Next page. All right. Can I ask for adoption of these minutes?
Chair,
move it.
I move the adoption of the minute.
Thank you. Any seconder? Honorable Chaba.
Yes, Chair, I second. I was in.
Thank you very much. So these minutes are also duly adopted, honorable members. There's another set of minutes. Yes, 21st of April. The Ministry, Department of Health on the APPs and budget for 2023-2024 financial year. First page, note whether you were present, marked as being present. Next page. There's the presentation. Anything you want to raise there, honorable? Next page. And the meeting was adjourned at 12:44. Thank you very much. I think those are all of the minutes, honorable Ms. Majalamba.
Yes, Chair, thank you.
All right, honorable members. So I was going to conclusion of this meeting earlier when I was reminded to first.
The last
complete
minutes have not been adopted yet, Chair.
Which one?
The last set of minutes have not been adopted.
Of the department.
Yes.
Yes, Chair.
Oh, I thought I'd ask for movement. All right, can I ask for somebody to move for the adoption of the minutes of the last set of minutes on the department?
I move for the adoption of the minutes, Chair.
Thank you. Any seconder?
I second the chair.
Thank you. Those minutes are duly adopted, honorable members. I was taking us to just planning for the next few weeks, which I had completed. And then I was saying that Honorable Wilson said that she wanted to note something towards the end of the meeting. And I also see the hand of Honorable Clark. Honorable Wilson first.
Thank you, Chair. There's two issues I want to raise, and the first one is the Presidential Health Summit. The invitation for the Presidential Health Summit was sent to the portfolio of health. The portfolio in its entirety received an invitation to go to the Presidential Health Summit. We were advised that we had been invited and would we please respond accordingly, to which we did. Now, after we cancelled flights and meetings and the whole bang shoot to go there, we now get told that no, sorry, only one person from this party and one person from that party and the other, you know, we get the numbers of who is allowed to attend. And I'm quite frankly horrified and shattered. We sit as a portfolio of health. One of the key discussions at the Presidential Summit will be the NHI, which is in our hands at the moment. And then we are summarily advised that no, not all of you can go. When an invitation is sent to somebody or a group of people in its entirety, they have the right to say whether they will attend or not. We responded accordingly, and we're now being told that some of us cannot go. It's unacceptable. I don't think it's fair. And I think you, Chair, of all people, should be the one who's taking this up on behalf of the portfolio to say, hold on, the entire portfolio wasn't being invited. And so those of the members of the portfolio who are able to make it should be allowed to go. So I'm putting that on the table, Chair, because we have taken this to a higher level. And it's concerning. We get information this week that the legislature, the health representatives in the legislature in Gauteng have been on an overseas trip, all of them on an overseas trip to Canada to go and have a look at the NHI system. We have not had one tour. We are hearing that numbers on these tours are being restricted, and yet the legislature who goes to do an oversight on the NHI, which is in our hands, which is our responsibility, for which we have asked for a study tour, has not happened. We're not even doing oversight on this committee at the moment. When we had an oversight period, it was cancelled. So that's my first concern, because at some stage this is going to have to be addressed, because we're being treated unfairly. Smaller parties are being marginalized despite the fact that they are contributing to these kind of things, and it's not acceptable. Secondly, Chair, and we have asked and we have asked and we have asked and we are not getting it, when are we going to see the annual reports of the provinces? We are riddled with complaints about what's happening in the provinces. We are being told there's no money. We're being told there's accruals. We're being told they're not meeting targets. And yet this portfolio is not, despite so many requests, being presented with those annual reports. And we haven't seen them for some time now. Please, can we make sure that that happens as a matter of urgency? Thank you, Chair.
Thank you, Honorable Clark.
Thank you, Chairperson. I have been covered by Member Wilson, but I also would like to raise, Chairperson, that I think you really need to take a stance in terms of this portfolio not being able to attend the Presidential Summit in its entirety. There are many members on this portfolio that give input towards whatever is happening at every meeting. And I really feel that smaller parties, the oppositions are now being marginalized. It is not right when you are going to be dealing with the most important legislation that the health department has ever tabled to Parliament through the Presidential Summit. And I really believe that the whole National Health Committee should be represented at that summit. Thank you, Chairperson.
Thank you. Any other members? Hello?
Thank you, Chair. Chair, we are noting the DA's consent, Chairperson, but Chair, I think they will be also presented in the summit as per allocation of members to attend the summit, Chair. And my surprise, Chair, because we know that they don't want NHI to be implemented in South Africa. And when we are debating, Chair, and when we were doing input, they did not submit their input, Chairperson, as political parties.
Point of
But
order,
now-
Chairperson.
But now, Chair, my surprise, Chair, is that they want to be forward, Chairperson, although we know that they are against the NHI. They don't want NHI to be implemented. We are also noting that, Chair, because we know that they are fighting NHI. They are fighting that we must be equal in terms of health, that all South Africa must get the same, must be treated the same, Chairperson. But Chairperson, thank you very much. ANC members will be attending according per invitation. Names will be forwarded to Ms. Machalamba, Chairperson. Thank you very much, Chair.
Honorable Clark, followed by Honorable Van Staden, Honorable Kaba.
Thank you, Chairperson. I raised a point of order in what Member Gela had said. She said that we did not submit our reports on NHI. I want her to withdraw that insinuation. Every report that we were asked to submit, we submitted well on time. We did our presentation well on time. And Member Gela seems to not understand the word democracy, where people are free in this country to openly debate on issues of concern. And we have the right to do that, and we will not be hamstrung because it does not suit the ANC, Chairperson. I will not stand for being insinuated that we have not done what we were supposed to do, and I want her to withdraw that. Thank you.
Thank you. I will come back to that. Honorable Van Staden.
Thank you, Chairperson. Now, I'm also grieved by the statement of Honorable Gela that opposition parties didn't give input in the NHI bill. We've been part of those processes since we've started with the NHI bill in 2019. And we've been part of the deliberations on the bill as well. We've also, you remember the matter about our own legal opinions we want to submit to the committee, which we had a meeting on the 29th of March. And it was extended for us, and we are still waiting on feedback on that. So it's not true that the opposition parties was not part of the NHI inputs and so forth. We've been part of it since the beginning in 2019. We've on all the road trips to public participation, the deliberation clause by clause in the portfolio committee. So I think we have done more than our input. It's just that our input, our own legal input on this matter must still be done in this committee, and that was addressed by various legal letters from my lawyers to yourself and to the House Chairperson, and we've taken this committee take a decision on the 29th of March. But that meeting should have been taken place on the 5th of April, and we are still waiting for that meeting to be done. So I want Honorable Gela to withdraw that remark she has made, and I think we have opposition parties has given more than our own input into this matter. Thank you, Chairperson.
Honorable Wilson. Honorable Wilson.
The chairperson, and yes, I'm sorry, I find the Honorable Geller's comments very demeaning and very unnecessary. But I want to go to something that she says. She says that one of the things that we are opposed to doing is fair treatment for all, that everybody gets treated equally. Well, on that very point, I want to be treated equally. I was invited to the Presidential Health Summit, and I want to go. And if we're going to use that argument, then please make sure that the members of the Portfolio Committee get treated equally as well. We were invited, we have the right to go, and no one should be telling us that we can't. Thank you, Chair.
Thank you, Honorable Kaba.
Yes, Chair, I think just to make mention of the fact that I think the composite of main rights, the political parties, is in.
I can't hear you. Sorry, Honorable Kaba, can't really hear you well. Maybe you speak closer to your microphone.
Yes, can you hear me now, Chair?
Better, yes, thank you.
Yes, I'm saying the composite of the invitation to the summit is indeed inclusive of all political parties, which that on itself welcomes itself. Except that I think there has to be an understanding of uniformity of operation for all portfolio committee members to attend this kind of sessions and invitations. Except that I think we are obliged that the summit is also inclusive of the provinces, wherein it will have sufficient impact on the matter. Lastly, Chair, I must also indicate that I am thrilled to realize that indeed members of this portfolio committee, especially from opposition, are eager and participating and looking forward to participate to implement the NHI. I think that indeed is noted, and we are ready for the summit, Chair. In case there may be any other matters they may like to raise individually, I believe the summit will be somehow visual, where the link is set, as we were earlier told. And if there is specific matters to be raised, they are represented. May as well raise a hand by the summit to find us already there. I think Honorable Geller was explicit and also welcoming that the ANC will indeed attend and all other stakeholders invited. Thank you, Chair.
Thank you very much. Honorable members, I'm going to answer those concerns of yours. Honorable van Staden, is that a new hand?
Sorry, Chair, I just forgot to mention also that Member Gela must also remember that the Freedom Front Plus also submitted a minority report on the NHI bill in November last year, which I received a letter from yourself and the committee clerk that you have received that. So I just forgot to mention that also. Thank you.
Yes. I'm going to take these matters in the order which they were raised. The first one is attendance at the Presidential Health Summit.
Sorry, Chair, if I may.
Yes, Honorable Wilson.
Please can we also understand that the Presidential Health Summit is not all about the NHI. There is a lot of input from a lot of people across the health sector, for which we are responsible. At the end of the day, we are the lawmakers. And there's going to be a lot of inputs on other matters, not just the NHI. And the fact that we are being denied access to that is very problematic. So can we just put the NHI aside as one of the matters that will be discussed there? Not about whether or not we approve or support the NHI in its current format or not. It's not about that. It's not just about that. I don't know why this is being made about the NHI. There are lots of discussions about a lot of things involving health. And we are being, as the lawmakers in this country, denied access to that information. I'm very sorry. It's not acceptable.
Thank you, honorable members. So let me start again with that, and just please remind me on the adoption of the report. Maybe I must just finish that. Remember that the adoption of the report is as is. This is a reminder that I'm talking about our committee report. Now let's go to the issues which were raised. I've tried to make an intervention already, and I will tell you why the decision was made like that. Now remember, it's not made by either the Department of Health or by the presidency or anybody else. This decision was taken by the House chairperson, and it has to do with cost. So I even made a suggestion that members could use their own flights, but it doesn't work like that. This is an official invitation to the committee, and therefore all costs are borne by the committee. And don't forget that we also need accommodation in Johannesburg. So that was the reason, purely based on cost, and it doesn't mean that they cannot. I'm going to try and have another intervention on behalf of our committee to try and get more of us to attend the summit. But in the meantime, you need to forward at least the name of the person if you were allocated one position, because we need to do all of the flight bookings and the accommodation management, etc. And so the process can at least start. And if we are afforded an opportunity to have more attend, then we would have initiated that process. So I'm really asking you kindly to do that. And also for those who are in the Johannesburg region, I'm sure there isn't a restriction. I'm not very certain, but I don't think there's any restriction on your attendance if you live in Johannesburg and you're close by, and there are no costs involved for the summit itself, and you're able to use your own accommodation and your transport to the venue, then you're very welcome to attend. And we should also get an indication of that. So it's more to do with the transport and the accommodation and other logistics. Second one is on the study tour. Ms. Majalamba and I had another discussion. We've been told that we need to complete the work on the NHI bill before we can have a study tour. We still have the thinking that we could still do a tour on the NHI as the basis of the reason for the study tour, even after we had completed the work of the work on the NHI bill. So we are in the process of looking at it again, doing the necessary applications again. And I'm really hoping that we'll be able to do this very speedily. And we're looking for this towards the end of June, because it takes quite a bit of time to process the application. That was our current discussion, and I'm sure this time around we'd probably be able to go on this tour. And then in terms of the annual reports of the provinces, yes, it is correct. It is a huge challenge. When honorable members speak here, it's almost as if they don't admit that the processes of parliament do not necessarily allow us to do all of this work. As much as we wish to, it's almost as if they not seen how the program of parliament makes us not be able to do certain things. And so please say in the manner which you do. And Honorable Van Staden mentioning their feedback was given. We were going to have a meeting during constituency period, yes, which is what I had pushed for. But unfortunately, the processes did not allow us. The powers to make the decisions did not allow us to have that meeting. So let's put it like it actually really is when we do speak, honorable members. Last one is Honorable Gela. Please, can you put what you had put differently? The honorable members are aggrieved in the manner that you put this, that you said they did not provide input on the bill. They had been with us throughout the whole process. They had participated in the meetings and in the discussions. And I think it does grieve them a bit that it is put that they had not participated, and also a reminder of Honorable Van Staden that even provided a minority report, which we had entertained and studied, etc., in terms of capturing what had to be captured in the work that we will be presenting next week. And then Honorable Van Staden, on your legal opinion, just to remind everyone else, the only political party that had provided a legal opinion was the Freedom Front Plus. The others had not. What I'm going to do, and I said this earlier, I'm going to allow next week on the 10th, every political party, not every member, 5 minutes to talk about any legal matters they want to raise. And then we will have a short discussion on it, and we will continue with the rest of the work, which would be on a clause by clause basis, where I'm not going to read each clause. I'm going to mention clause 1. Political parties, you've had an opportunity to make written submissions. Some of you were very late, but we had yet allowed you for those submissions to be used or to be honored. And so I'm going to say that as a chairperson, I've been very lenient and I've been very kind to everyone to the process. So we're coming towards the end of that process. I see from Honorable Clark, I just need to be reminded, she says they also submitted, the DA supported a minority report on time. And yeah, thanks for that reminder too. So in conclusion, honorable members, before I do that, Honorable Gela, would you want to withdraw maybe part of what you said? And I think it's particularly just on the fact that the other political parties had not participated in the process of the work on the NHI bill, the legislation part. Honorable Gela?
Yes, Chair.
It's only that one small specific matter.
Yes, Chair, I withdraw the part of not participating. They were participating, Chair, in the process, but not supporting the NHI, Chair. Always they are negative. They don't want NHI to be implemented. That's why they are dragging, Chair.
Thank you very much.
Submit.
Thank you.
Point of order, Chair. Point of order, Chair.
Honorable Clark.
It's not, it's Honorable Wilson, Chair.
Honorable
You either
Wilson.
withdraw or you don't.
Pardon?
You either withdraw or you don't. No buts. You withdraw or you don't. There's no buts.
I think she said she withdraws. She just wanted to add something. Can we just, she said she withdraws, please. Can we agree to that and not go down this line now? You've done so well.
Chair, I did withdraw, Chair.
Yes, yes, I agree with you.
Yes, I withdraw the chairperson. But chairperson, we are delayed because of them, Chair. Remember, they just marched out in the meeting, chairperson, when we were busy. And also, Chair, came up with their tactics to delay the NHI, Chair. It's what I was saying, chairperson. We are here, chairperson, because of their delays. If they didn't delay the process, we were supposed by now being tabled the report in Parliament, chairperson.
Thank you. Honorable Kaba?
No, thanks. I'm in the meeting. I hear very well that Honorable Gela had indeed withdrawn on that part. But also I must also mention that I think other members from the portfolio, I think we realize the energy that NHI must be a reality and they are really willing and ready to come and participate. Let the summit be part of helping us and opening us further for our ears and eyes for NHI implementation. Thank you, Chair.
Thank you. Honorable members, we're drawing to a close on this meeting. So just in summary, the committee has adopted its report on the APPs and the budgets of the department and the entities as it was presented here. Number 2 is I will have a discussion on the committee secretary and and to see whether we'd be able to get more of you attending the Presidential Health Summit, but you will also forward the names in the interims because there's a lot of logistical work that has to happen. And this can't wait over. We might also even already have a challenge with flights in the absence of you assisting us. And then we'll be reminded of the inputs which were made on the study tour and the annual reports of the provinces. And also, just finally, as a reminder that on Tuesday, the adoption of the report of the committee in the House. On Wednesday, the work of the NHI legislation starts again Wednesday, the 10th, Friday, the 12th, and then it will be printed, the A-list will be printed, B-bill will be printed, we will do the work, the committee secretary and I, in terms of proofreading, etc., etc. And then we bring it back to the committee on the 24th of May for a final decision on the B-bill. So thank you, honorable members, for a good meeting. It's much appreciated. This meeting is then adjourned.
Thank you, Chair.
Thank you, Chair.
Recording stopped.
Thank you, Chair.
Thank you, Chair.